So let's go. If you guys have any questions, feel free to ask in the chat. For some odd reason, it didn't download. Where is it? It was supposed to download. It didn't download. I just saw it. Why didn't it download? Let's see. Let's grab it manually. No, it's not here. It didn't work. But just going to download it once again. Let's go. I need this. Let's just yeah, now it worked, I guess. Let's see if it opens up. It does open up, thank God. Thank you. Here it is. Let's go put it side by side. It seems we have a lung window and some sort of enhanced mediastinal window. Rip some lip outdoors said I have an MRI scan that I need a read on. If that's something you can do, or do you only accept MRI scan from doctors? I could read your scan, it's all right, but I'm only allowed to report scans in Brazil. It won't work as a proper medical opinion in your country. I don't know where you are, Rip, but if you, I could read. If you have the digital images, the icon images of your scan, just feel free to share with me on the Discord. Just join the Discord, and there is a chat, a general chat there. And as soon as I finish this live stream, I can reply to your comment there, and we can see what I can do. Okay, I'll be glad to look at your scan. It's going to be fine. So just as a disclaimer, I can't really report scans outside of Brazil in a official manner. It's illegal. So this is a chest scan. So this patient has some kind of venous catheter right there, a deep central venous catheter. There are some tiny spots of ground glass opacities on the upper lobe, and let's see if we see anything else. Right there in the lungs, some micronodules right there, cortical micronodules. All right, another one right there, maybe a tiny one. Some tiny spread out micronodules, some tiny ground glass opacities. Nothing major really. Yeppers. Those micronodules usually aren't of much importance right there. Just incidental findings. Contrast enhancement. Let us look for acute thrombosis, aortic dissection, intraventricular and intraatrial thrombosis, all that good and deadly stuff. And there is none in this case, but it's really tough to look for calcification, vascular calcifications in such cases. So I have to go for a bone window, just as that, to look for calcifications, vascular, anything. I'm just going to do an NPR right there because this is an oncologic patient, so we must look for some kind of bone tumor that could present itself as a nodule on the vertebral bodies, posterior segments, and sometimes the rib cage. This patient has a partial fusion of the second and third ribs on the right. This is a anomaly, an anatomical anomaly, but it isn't really a disease. There is some spondylosis right there, nothing much, just a malformed, partially malformed rib cage on the right. These tiny spots of sclerotic lesions are usually just sparse ossification. They are really of importance, just like that. These are just bone aisles or anostosis, nothing much. This is just degenerative disease, such as this also. So there isn't much. See that catheter right there? This is a deep indwelling catheter for chemotherapy. Usually chemotherapy does that to you. You did that for chemo. So we only have tiny ground glass opacities